Welcome to the Field Notes podcast, presented by Seaworthy Functional Medicine. Seaworthy exists to help you overcome your complex health challenges, so you can be fully vital. Now, here's your host, Heather Moon.
Our skin is like that honest friend who tells it like it is. Breakouts, rashes, random redness. It's all feedback and information. We call it skin, but it's really a conversation between your body, your environment, and it reveals everything you put in and on it. We are tuning into that conversation, and we will be learning how to take care of and make peace with the messenger. I am so fortunate to be joined today by my friend and fellow nurse practitioner, Marcia Mankin. Marcia was raised in the wilds of Wyoming, where her first surgical patient was at the age of 10 on her ranch. She was an RN for 17 years before she became a nurse practitioner. She's been in the operating room for 25 years. Marcia, thank you so much for your time today. Before we get into the podcast, will you share with me and with our listeners who've joined us today those details of your first surgical patient at the age of 10 on your ranch? We can't move forward without getting the details of that fact.
Well, first of all, Heather, thank you so much for having me on today. I'm so excited. It's good to see you. So every ranch kid that has ever grown up knows that sometimes you do some jobs that are maybe less palatable than others. But we raised sheep and cattle on our ranch, and in the middle of nowhere in Wyoming. It was 25 miles to 60 miles to the nearest town. So you learn to do a lot of different things. But at age 10, the sheep would come in from the field with abscesses in their face from eating the grass, where they'd get a little cheatgrass or something in there. And it was my job to lance and drain those abscesses at 10 years old.
What a joy. What a joy. And you were just forever there inspired to lance and drain.
I loved it from that moment on.
Okay, good. I'm glad that was a good experience for you. Well, thanks for sharing that. As I mentioned in the intro, Marcia is a nurse practitioner, and she's currently practicing on the Kenai Peninsula. Having the good fortune to know her personally, I know that she wears many hats. Marcia, can you share with the audience all the hats that you wear as a nurse practitioner, and also a genesis story about how you came to wear all those hats?
Sure. So right now I practice in a couple of different places. I am a surgical nurse practitioner for Central Peninsula Surgical Associates here at Central Peninsula Hospital. But I also own a very boutique medical spa business that does some skin and some medically supervised weight loss here on the Kenai Peninsula, branded to be Elevate Health and Wellness. So I do that. And then in my spare time, I actually help out our urgent care as well. So I see patients from all ages, from all different walks of life with urgent care problems. So a little bit of everything.
Little bit of everything. In your spare time, you practice at the urgent care. Great. Well, thanks for sharing that with us. You certainly are talented, and your services are appreciated in our community here on the Kenai Peninsula.
Well, I appreciate that.
Yeah, thanks. You mentioned you have your own practice in Kenai and Soldotna. Would you mind sharing a little bit of the details about what you do at that practice?
Well, I think every superhero has their origin story. So let me tell you how I got involved in the skin business. As it was when I was a young woman, I was raised at elevation 7,280 feet. And so when you are raised that high in the mountains, sun damage has a tendency to be at the first and foremost, because the atmosphere is thin and the sun beats down on you in Wyoming. There's not a lot of anything else to shade you. At 24 years old, my grandfather died of malignant melanoma, and it was a terrible, terrible death. And it was 100% preventable. And so that kind of piqued my interest. My mother had been very good about putting sunscreen on me as a kid. And it wasn't until a few years later when my father came down with a melanoma that had to have a wide area excision and some other things done to it, that I really got serious about it. And when I joined a surgical practice, we also had dermal plastics in with it, and everything is married together. You are a single unbelievably engineered being. And I loved that part of it because even in my day-to-day practice, everything starts at the skin level. And so that I've dived into that. I've been a partner in a medical spa, and it is just kind of evolved into that. And then I moved to Arizona. And so you have not seen anything until you've seen Arizona skin. So when I came up here, I brought what I had learned and practiced with some different philosophies that I had picked up along the way. And like I said, it's a pretty boutique practice, but I really enjoy it.
Brilliant. Thank you so much. That's really interesting. It's always fascinating to hear everyone's Genesis story. We are so fortunate here at Seaworthy to be able to meet with some of the best and most brilliant minds. And I always just really love hearing their Genesis stories. So thank you. So diving into some questions for the audience, whom I'm really, really thankful for joining us here today. What are some of the underlying systemic issues that show up first in the skin?
Well, I think it's important that we remember that our skin is our first and sometimes last barrier of defense. Your skin is your largest organ. Your integumentary system comprises not only your skin, but your sweat glands and your hair follicles and a layer of fat underneath that. But it tends to be the most neglected system that we own. You know, when our heart goes bad, we know it. And you know, when we have a bone that is not functioning appropriately, we pay attention to that, but we sometimes tend to neglect our first layer of defense, and we think about all of the things that we come in contact in a daily basis and how our skin saves us, all of the chemicals, all of the weather. I knew to put a coat on this morning because the temperature sensors in my skin told me so long before my core body temperature signaled that I would need one. And so it's important to know that everything from the inside can sometimes flash onto the outside as well. So chronic skin conditions sometimes tell us a deeper story than that. You know, we look at some of the more serious pathologies that we look at. The one that comes to mind right off the top of my head is systemic lupus. Sometimes the first flash that we have of an underlying autoimmune disorder arrives on our skin in the form of a rash that we're unsure what is. It can be on our face. It can be in our hands. You know, sometimes those types of things are left and just discarded because they are what they are. We live in a cold climate, that kind of thing. But it really, we should be paying attention to that because it speaks of deeper underlying issues.
That's really great. And the message I'm getting is that we should not only look at, but listen to our skin and try and see the message is trying to send
It's trying to tell you something that is deeper usually than your skin itself and what you see in the mirror every day.
Right. Okay. Thank you. I appreciate that. That's really valuable information. What dietary patterns do you find are most supportive for healthy skin?
So I think it's important for our listeners to know that there's a lot to be said for you are what you eat. And those are really what we put in our mouth is reflective of our everyday health and wellness. And doing what we do, we know that. Right, that we sometimes make good choices and we sometimes make bad choices. And the dietary changes of fresh fruits, vegetables, whole grains, make sure that we're getting enough protein. Protein not only builds strong bones and strong muscles, but helps with collagen regrowth, which is one of those things that as we, you and I in that age group know sometimes is a problem with our skin as we look at aging and we look at the overall tone and condition of our skin as we get older. Those types of dietary changes are important. I can walk into a room and tell you if you drink alcohol because it's written right all over your face. Those little tiny spider webs that we get called telangiectasias on noses, they don't lie. So, keeping our alcohol to a moderation or even better to a minimum can overall help our skin. And it goes back to the question you just asked me and our overall wellness.
Yeah, that's great. I certainly, as a nurse and a nurse practitioner, picked up fairly early on in my career that you can tell a lot about how someone's feeling just by looking at them, whether their skin is kind of gray, whether it's rough, whether it's smooth, whether it's bright and brilliant.
Yeah, jaundice shows up if you're having liver issues. We know that, right? Because your skin tells us that you're having that. If you're having a terrible psoriasis flare, which is an underlying deeper issue, there's some autoimmune issues that go along with all of these types of diseases. I know that because your skin tells me that. If you've gotten a good night's sleep, your skin tells us that.
It sure does. It even portrays emotions. You see someone who's frightened or angry, and their skin is going to be sheet white or it's going to be bright red. And so our skin is so fascinating. It communicates diseases, and it also communicates our emotional state and our digestive and microbiome health.
Yeah, it tells the story of our lives, right? So, and it really is the first thing that people see of us coming down a hallway or when we meet someone. Before we've ever said anything, it tells us what kind of lifestyle and what our day looks like.
Right. Yeah. How do stress, sleep, and emotional health show up in the skin? We talked about it a little bit earlier.
Think of the last time you got a really poor night's sleep and you got up in the morning and you're like, oh, everything looks a little swollen and puffy and saggy and a little gray, and your color's a little off, and your skin isn't as smooth and supple as it was. And all of those types of things show up fairly rapidly. Your hydration levels show up in your skin. Immediately someone's been crying, right? Because of the way that their skin gets puffy and red, and those types of things show up in fairly rapid order, and then could kind of progress into some long-term looks on the skin that you know of when you have had long-term emotional stress. Sometimes the dullness, the brightness goes out of our skin just because the things that go with that we do to take care of our skin, good daily skin care, good sleep habits, good exercise habits. Exercise is not only good for our blood flow to our heart, it's great for our blood flow to our skin. It's great for our blood flow to our peripheral circulation, our hands and our feet. All of those show up on your skin, on your face, on your hands. I look at my hands after 25 years in the operating room, and they don't look like they did 25 years ago from repeated washings, from just exposure to the environment.
Right. Yeah, and you can tell where somebody is from based on their their face. You can see age marks and sunspots and things like that. Yeah,
absolutely.
Really is fascinating just how much information the skin gives us about our history.
Paragraphs of how we are on the inside and the types of things.
So one of the things I've been thinking about as I got ready for our interview today is the double-edged sword that we face, that is the availability of all the information that's out there. And so I would like to know myself, and like our listeners to know, what trends or misconceptions in dermatology or skincare are concerning to you right now?
There's a couple of them, right, that are kind of concerning to me right now that I don't know as though the literature is solid on. So we always have to weigh what is scientifically sound, what is on-label, and what is off-label use. So we do use some things that are off-label. But a couple of things that really kind of raise my eyebrows, not only from a dermatology standpoint, but from a plastic surgery standpoint, and from a surgery standpoint alone, The first one on my list is PDO threads. And prior to you and I just doing this interview, I just came from a big hernia repair that I did on a patient, where they had an abdominal hernia repair. And that same suture that I used to repair that abdominal hernia repair is in a smaller gauge, placed in those PDO threads and pulled up through the skin itself. And that causes me some great consternation because it's the tightness you get from that is caused by an inflammatory reaction. And our whole goal in our life should be to keep our inflammation, internal and external, to a very minimum. And so that is not a procedure that I personally recommend. I've picked a lot of those out doing some facelifts in my career, and they have a tendency to cause some scarring and that kind of thing in the deeper levels, which may cause us to have maybe a misdiagnosis of something deeper at a later date. If we're looking at a skin lesion, can we be sure that that is an actual dimple from a PDO thread, or is that something that we need to be looking at under a microscope as a dermatological biopsy to make sure that that's not something more sinister? So that one causes me some stop. The other one that I think the jury's still out on is the platelet-derived growth factor, or PDGF, and it's all over Instagram and all over the medical spas and all over the everything right now. And that is one that also I have paused to take a look at, because on the outside of the syringe it says for topical use only, not for injection. There's been a lot of debate in the medical circles about whether that is going to cause problems down the line due to the way that it has been formulated. And also our lack of studies in injecting it. And some people do use it. Until I have some hard data coming out on that, I'm a little reluctant. First of all, I don't know. So when we're treating things like that, we need to make sure what it is that we're treating. There's no one broad global fix for everything, right? If I could throw one thing at somebody and cure all of their skin issues, that would be great, but that doesn't exist. And so until the science comes out and that has been resolved, that is one of those things I will be reserving and choosing not to offer in my practice.
Okay. I always appreciate the discerning provider who is interested in looking out for the overall health and wellness of the patient rather than just making the money or offering the instant gratification that so many of us look for in these days.
Right. We like it now. And I think that's one of the things that we look at in aesthetic medicine and skin medicine and in medicine in general, is that we want the now. And sometimes the now is more detrimental than the work that we need to put in to get to the later.
Right. Yep. It's a marathon, not a sprint in a lot of cases. Yeah.
Sure is.
Are there layperson names for those two procedures that you mentioned?
So there really aren't. Those are the lay terms. In there is the PDGF, or platelet-derived growth factor, and that's, like I said, it's all over the TikTok, it's all over the gram, on both sides, right? And then PDO threads are PDO threads. That's what they call them, or facial threads. It can also be called a non-surgical facelift.
Okay, that's all. Thank you. I appreciate that. I just kind of myself, and I want our listeners to be on the lookout for things that may have kind of an enticing name or an attractive, catchy name.
Yes. And there are good things that you can do to help improve the look and the texture of your skin that are scientifically backed and we have lots of data on.
It's helpful. It's nice that we have a lot of resources out there. We don't necessarily have to reach for those that we are not so certain about.
Yes, correct.
Well, that's an excellent segue. If you were to give, if you would indulge myself and our audience in a single impactful step to support their skin health, what would that be?
It would be to wear sunscreen. So there's a couple of things that, there's a number, and I carry a number in my practice of different types of skin things. There's many brands out there, both drugstore all the way up to however much money you want to spend on something, right? But the principles underlying all of this are the same. You should always take the night off and take the day off, which means wash your face. Use a very gentle cleanser. It can be a drugstore brand. The Cetaphil brand is over the counter. Lots of different pharmaceutical grade cleansers out there. But the bottom line is that you're removing all of the impurities that you've come in contact with the day. So as you walk through the environment and through the atmosphere, you're going to encounter all sorts of things. It's like we talked about, just a few minutes ago. Your skin is your first line barrier defense. Patients that are burned, for example, if they survive the initial fluid loss, what they die from is overwhelming sepsis, right? Because their barrier is lost. So we have to protect our barrier. And the number of things that you touch in a day and the number of times you touch your face. So you should wash that off at the end of the day. And then wash the night off as well. I mean, sometimes you wake up and you've drooled all over everything. You've rubbed your face all over your blanket, or, the dogs licked you in the middle of the night, or those types of things, So washing your face, and then, but the single most important thing you can do for your skin is to wear sunscreen every day. And the sunscreen in your makeup, unless you're applying it 55 gallons at a time, for our female presenting listeners, is not enough. You need an actual layer of SPF every day, and then wash it off at night.
I feel like I need to wash my face right now.
I know, isn't it? I mean, think of all of the things. Think of all the things you've touched today, and then
Yeah. Or what's out there in the air.
It is, and it's all the reason that you're not sick from everything that you come in contact with is because your skin protects you from all of that. I mean, think of dish soap, or everything that you've even the minor things that you come in contact with. Washing your hands every day is a fantastic practice, but without your layer barrier, you would dissolve everything underneath it with just soap. So your skin is amazing.
We have quite a debt of gratitude is what I'm really coming to understand after having visited with you for just a short time today. We really owe our skin a lot.
Oh, a lot. Yeah, it keeps us from wandering around looking like a meat-covered skeleton.
Well, I really appreciate that. And it's been just really wonderful to connect with you today and to gain some valuable information and some resources. You have a lot of experience and a lot of skill to share with our community. So where can people find you? How do they get in touch with you?
Sure. So you can usually find me on the Instagram at Elevate Health and Wellness. All of my contact information is there, and there's a lot of word of mouth. I'm sure that if listeners need to get a hold of you, you can send them my way as well.
I'm certainly happy to do that and eager to help get them set in the right direction so they can get their skin in order.
Sounds like a plan.
Great. Well, I really appreciate your time today. It's been great to connect with you, and I look forward to meeting up with you again sometime in the future.
Heather, it's been great to talk to you and to your listeners and your patients today. And happy skin trails to you. Wear your sunscreen.
Thank you. Thank you.
Thanks for joining us for the Seaworthy podcast. Seaworthy exists to help people overcome their health challenges and be fully vital. If you think we've earned it, please consider giving this podcast a like, subscribing, and giving us a 5-star rating on the platform of your choice. Thanks.